Hello, my name is Ariely Cleto Morel, and I'm going to read Unit 3 Nurses. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training, staff nurse, a nurse who has completed the training course, charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department, nurse manager, a nurse who is in charge of several wards. Note: the old-term system is still sometimes used for a field charge nurse. A field nurse manager may be called matron. Dr. James is talking to Sister Watkins. Support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerks, whose duties include making sure patients' notes and information are up to date and answering the telephone. Specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community giving advice on the promotion of health and the prevention of illness. The nurse role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rate, and blood pressures, changing dressing, giving injections, and removing sutures. Nurses now do some of the things previously and reserved for doctors, such as prescribing drugs and ordering laboratory tests. Much responsibility for nurses is planned, as the following article demonstrated. Nurses carry out surgery in effort to cut patient waiting list. Nurses in Scotland trained to perform neurosurgery have entered the operation theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign molds and cysts. The birds performed and carried out are used with all types of procedures. They are often used in the passive form. Perform and carry out an examination, an operation, a procedure, an experiment, a test, or biopsy. The procedure was performed or carried out by a nurse. Chapter 8: Allied Health Professionals. Community Health. The health of the community depends on a large number of people other than medical practitioners and nurses. These can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move by getting them to do exercise or by training their body with the heat or massage. treatment by manipulating muscle and joints with hands. See Unit 42. Occupational therapists, OTS, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiro- Chiropractic, also known as podiatrist, three conditions affecting the feet. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians, ambulance technicians, work in the emergency medicine service. An ambulance technician with more advanced qualifications is called a paramedic. Prosthetic and ortho, orthotistic. Prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis, or a device to support or control part of the body, orthosis. They also advise and rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacements for patients who have had an amputation or were born without a limb. Orthopedists provide a range of splints and other devices to aid movement, correct deformity from a normal development of a part of the body. For example, club foot, talibis, and relief pain. Opticians. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of light inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer to the patient to their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in disease of the eye. Chapter 9. Hospitals. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to be trained on an elective attachment to Royal Infirmary at Denver. Dr. Barron is introducing him to the hospital. Dr. Barron, the Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illness, except pediatrics. We have a specialist hospital for that in another part of Edinburgh. The hospital for sick children. You can see some of the departments in our hospital on scene. Of course, there are many others. For example, the intensive care unit and the surgical high dependency unit (HDU). Jordi, what does outpatient mean? Dr. Barron, Outpatients are the people who come to hospital to attend a clinic or to test or treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. Though entries, corpacks, C&D, visitors, and staff. The Simpson Center for Reproductive Health, Gynecology Emergency, Maternity Emergency, Neonatology Emergency, Outpatient Department, all wards, day surgery unit and endoscopy, X-ray department, and combined accident. Outpatients. Dr. Byron, the Accident and Emergency Department, A&E, also called casualty, is where patients who are acutely ill with a sudden serious conditions come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDS. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients, Dr. Barber. The inpatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for the admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspected myocardial infarction, or they are seen in the A&E department, where the doctor on duty, working at the time, arranged the admission. This would happen in the case of a patient with a fractured neck of a femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi assessed. Dr. Barra, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Well, thanks for everything. I finished Unit 3.